amid the global concern over a new coronavirus strain has been one piece of hopeful news. Those infected with the Omicron variant appear to have very mild symptoms, according to the South African doctor who first spotted the variant. She also added two unusual and different symptoms she had found differing from the Delta variant. A doctor who treated patients with the Omicron variant was the first to sound the alarm of the new variant, saying it causes unusual symptoms. Dr. Angelique Coetzee, who runs a private clinic in Pretoria, said the Omicron variant does not cause loss of taste and smell and breathing problems as previously seen in the Delta variant. Dr. Coetzee warned of the two unusual symptoms she has seen included intense fatigue and high heart rate. New COVID variant fears: there are two COVID symptoms in fully vaccinated to spot. We had one very interesting case, a kid about 6 years old, with a temperature and a very high pulse rate, and I wondered if I should admit her. But when I followed up 2 days later, she was so much better. Describing the Omicron symptoms she has seen, Dr. Coetzee said, "They were so different and so mild from those I had treated before. Dementia breakthrough, the daily food to eat that strongly reduces risk of decline, insight arthritis, 4 foods that are big inflammation triggers, how to avoid joint pain, tips blood pressure pills recalled after chemical found with potential link to cancer." Latest symptoms at that stage was very much related to normal viral infection. And because we haven't seen COVID-19 for the past 8 to 10 weeks, we decided to test, she told Reuters. "We have seen a lot of Delta patients in the third wave. And this does not fit the clinical picture. Most of them are seeing very, very mild symptoms and none of them so far have admitted patients to surgeries." Professor Lawrence Young, of Warwick Medical School, said, "This variant carries some changes we've seen previously in other variants but never altogether in one virus. It also has novel mutations that we've not seen before. Some of them mutations that are similar to changes we've seen in other variants of concern are associated with enhanced transmissibility and with partial resistance to immunity. We need laboratory studies to determine whether the antibodies induced by current vaccines are able to block infection with this variant. The exact location as to where this variant began has been thrown into turmoil. A new report found Omicron was in the UK for at least 4 days prior to South Africa warning the world of the new variant, with 9 cases in Scotland traced back to before the UK introduced travel restrictions. Elad Maor, 45, cardiologist at Sheba Medical Center near Tel Aviv, travelled to London on November 19 and stayed at a hotel in Islington while attending the 3-day convention at Excel London in Newham, East London, before returning to Israel. He then tested positive for the virus 4 days later, on November 27, and suffered mild symptoms including a sore throat, fever and muscle ache.